they present it as something that is necessary for a quote unquote balanced budget. That's why when we brought up these 5% cuts, that's why the governor's first thing was to say like, oh, well, we're only doing that so we can maintain our great eligibility window. And it's like, well, you're creating a false dichotomy. We don't have to narrow the eligibility window or tax people for their health care. They're creating this scarcity narrative like, oh, well, we have to make tough choices to balance our budget. Bullshit. No, we don't. There is plenty of fucking money that you could be getting from people who have plenty of fucking money, and you're choosing to keep it in their pockets instead of using it to pay for programs that keep people alive.
One quick thing brings you easy, actionable ways to support your local community in these times where we need it most. If you're feeling overwhelmed and don't know where to start, join us on this journey. Today, we're talking to Jules Good of the New Hampshire Hands Off Medicaid Coalition. Jules is a multiply disabled queer and trans activist and disability policy professional. They've been involved with disability policy and accessibility work in New Hampshire and across the country for their whole career. They walk us through the primary functions of Medicaid, as well as what services and populations will be affected by current proposed New Hampshire state budget cuts.
Like, he has the best... He gets to sing the part at the beginning of There's a Light. That's so good.
Yes, it's the best part of the whole song.
Yes.
Yeah.
It is.
That's fair.
Well, so tell us a little bit more about kind of how you're having fun these days. Like, you're very entrenched in the activism world.
Yes.
And I feel like a lot of the activists we talk to are just like, really, you're in the shit every day.
Correct.
And so like, talk about how you're like balancing your life out a little bit before we get into the meat of it.
Well,
are you having any fun? Are you okay?
Are you having any fun? I am having fun. I'm very lucky to have very like supportive friends and people in my life. And a lot of those people do musical theater. Shout out to Dive In Productions, which I've been fortunate to do lots of different shows with. And so they have like a cabaret coming up at the end of this month. And then I'm going to be doing some other musical theater at Hackmatack Playhouse at the end of this summer. So that's kind of been my happy fun time hobby. I actually started doing musical theater like from being in the pit because I'm a classically trained string player, and so that's how I first got involved, playing like accompanying their shows, and then I auditioned for one and got in, and then I've like been doing both pit and stage with them and a couple other groups too, which has been super fun for the last couple of years. And then the other thing that I do on a more regular basis to like take care of myself is I'm training for competitive powerlifting.
Good for you. Oh my gosh.
It's like, it serves a dual purpose because one, like I've always enjoyed like moving my body. It's like a very important part of like maintaining my sanity, what's left of it. And like I also, because I have a progressive neuromuscular disease, I have to like be proactive about keeping muscle because like the more you have, then the slower it goes away. And so I'm like I've been having a lot of fun doing that training, and I'm hoping that I'll be able to do some competitions like later this year, which I think would be a blast. So yeah.
Oh, that is so fun. Getting ripped for the resistance.
Ripped for the resistance.
I love that.
Yeah, that is the most effective hobby.
It's great. I mean, yeah, it's been a lot of fun, and I think, you know, like it's been great because like you literally can't like multitask when you're doing it. Like I feel like when I try to unwind at the end of the day, like watching a show or whatever, like I'm still just doom scrolling. I'm still in all my Signal group chats. I'm still working like all the time. But when I'm lifting, I can only be lifting.
That's such a good reminder. And people who do activity say that all the time. And I need to heed that advice. Because it's
nice.
True. It's like you can just close your brain off a little bit.
Yeah.
Because you have been like very, very you've been dealing with a lot lately. You're in the trenches with what's going on with Medicaid right now. We're going to get into what's happening sort of a little bit around the country, specifically in New Hampshire. But can you give us like a little bit of a basic? Because Emily and I, as we were getting ready for this podcast, we were like, okay, I have just a basic understanding of what Medicaid is. And I think a lot of people feel that way. And it's a very, very hot topic right now. So not hot topic in like a fun way, but
everybody hot topic pejorative. Yeah.
We're going to talk about Medicaid. So tell us a little bit about what actually is Medicaid. And then are there any like misconceptions that come up a lot?
Totally. Yeah. So Medicaid at its core is a federal state partnership program. I'll get into what that means in a minute. That provides healthcare and services to older adults, people with disabilities, and people who cannot otherwise afford healthcare, which usually there's like overlap between those three groups. And so Medicaid provides health insurance so that people can do things like go to the doctor and get medication and get all other kinds of healthcare without having to pay an exorbitant amount out of pocket. And then it also funds very essential services for older adults and disabled people called home and community-based services, or HCBS. So this is where kind of the federal state partnership part comes in. So every state gets like a pot of money from the federal government for Medicaid, and states often have their own money that they raise through their state taxes and stuff that they contribute to that pot of Medicaid. But the important thing to know is states have a pot of money for Medicaid, and a good chunk of that goes towards something called long-term supports and services. Long-term supports and services is healthcare that people use, as the name suggests, longer term, right? So it's not just like one doctor's visit. It's like, I'm a person who needs help, like getting out of bed and getting dressed every day. So I have someone who comes into my home and helps me out, right? Not me, but saying hypothetically. There are people, many, who rely on those services to be able to live their lives and do everyday activities. Part of a good amount of that LTSS money goes towards paying for institutional care. Institutional care is things like hospitals, nursing homes, so care that takes place outside of somebody's home or community. That is like not optional. Like states have to pay for a minimum level of funding to keep that care going. The other place that people can get care, that long-term care, is in their homes and in their communities. So things like having home healthcare staff who come and help somebody, things like day programs where people can go and do like job skills building or certain kinds of like rehabilitative therapy during the day, job support to help people like find and keep employment. So it's a wide range of services. That is technically optional for states to provide, which is wild to think about. But so states have to fund care, a certain level of care that happens in institutions. Mm-hmm. They can fund home and community-based services. And because it's optional, it gets administered through what we call waivers. So in New Hampshire, we have a couple different kinds of waivers. They're typically split by what community they serve. So like we have a waiver for people with developmental disabilities. We have a waiver for people with traumatic brain injuries. We have a waiver for like acquired, I think the traumatic brain injury and like acquired spinal cord injury are grouped together. So there's a couple of different ones. And when you apply for waiver services, you apply for whichever one fits your situation. And so because those services don't have to be covered necessarily, whenever there are funding cuts on the table for Medicaid, those services are the first to go. In New Hampshire, we already have a huge staffing shortage for providing those services, and a lot of people simply don't get the number of hours per week, per month, whatever, that they need to live their lives. And so family caregivers step in, volunteer organizations might step in, but those are not sustainable ways of providing care for people who need care, at regular intervals over maybe the course of their whole lives. So really, when you look at like all the different things that Medicaid provides, the simplest way of explaining it is that like it's a lifeline for people. Your choices are either, go into extreme debt if you don't have health insurance coverage, go and live in an institution where your rights and autonomy are stripped away and where people historically have been very abused and neglected, or in a good world, you get good home and community-based services. You're able to receive care and support in the setting of your choice. And so that's kind of like the basics of what Medicaid is and what it looks like.
Yeah. Are there any specific misconceptions too that you come up against when you're talking to people, or anything that like people don't know that you sort of bump into a lot in your work?
Yeah, one of the biggest ones is people think that people are on Medicaid because they don't want to work, which is wild because and unfortunately that misconception is fueling what would be a disastrous policy change at the federal level and in several states, which is the introduction of a job loss penalty for Medicaid. So basically what that means is if you don't prove that you're working at least 80 hours a month or engaging in some other like qualified activity like going to school or doing community service or something, then you lose your healthcare coverage. So the problem with that, aside from the fact that it's fucked up and terrible, is that about 70% of people receiving Medicaid are already working. So the reason Medicaid allows people to work. So like I have a friend and fellow activist, Jim Piet, who is brilliant and amazing. He has cerebral palsy. He uses a power chair. He needs support, to like get up, get out of bed, get dressed, get out the door, get to work, etc. For about 30 years, he worked for the state of New Hampshire for, I know at least for part of that time, for vocational rehab, so helping other disabled people find and keep employment. And I think in some other like similar roles as well. And he was only able to do that and work full time because he had Medicaid and because he had those supports. And so it's not like people are going on Medicaid because they're trying to skim off the top or scam the system. They're doing it because they don't have another choice because their employer doesn't provide private insurance, which is the case for lots of employers, but especially like small businesses who simply can't afford it. This all came from like, the like welfare queen stereotype of the Reagan era, right? Mm-hmm. And that continues today. And we see, like federal legislators and then our state legislators mimicking these talking points of like, oh, well, we're cutting the parts of Medicaid that we're cutting waste, fraud, and abuse. We're cutting all of these places where people are scamming the system and people are getting services where they're not supposed to be. But if you look at the data, that's not happening. And a lot of the like mistakes or like quote unquote fraudulent claims that hope it happen in the Medicaid system are because of things like somebody's address changed and they forgot to file it with Center for Medicaid, or they changed jobs and so like their like income adjustment needed to be made and it wasn't. It's not people who are willfully scamming the system. In fact, most people on Medicaid who are able to work are working and contributing and being part of their communities. And they're only able to do that because of Medicaid. And if somebody can't work, which is the case for a lot of people, they should still be able to get basic health care and live in the community and be treated with dignity and respect and not locked away in an institution where they're going to be abused and neglected.
Mm-hmm. So we've been hearing about some changes coming up in Medicaid on the state budget. Can you walk us a little bit through what's being processed right now?
Yeah. So the important thing to remember about Medicaid in the state budget is that it is the place where we can protect residents against the federal cuts that are more than likely coming. Because New Hampshire has something called a trigger law, that means that if federal funding doesn't cover at least 90% of the cost that it takes to run our Medicaid expansion program, which I'll explain what that means in a second, that's coverage for a lot of people, then that program simply goes away. So Medicaid expansion is in New Hampshire, it's called Granted Advantage. So it's a version of Medicaid that more people can be a part of. So this Medicaid expansion in all states came out of the Affordable Care Act. And it was basically a way to say like, hey, the eligibility requirements for Medicaid are really narrow. Mm-hmm. And there are a lot of people who are falling through the cracks of not being eligible for Medicaid, but still not being able to afford private insurance. How do we help those people? So Medicaid expansion kind of broadens the pool of who can get Medicaid, and has been an essential part of people getting services that they need. So if federal funding for Medicaid goes down, New Hampshire, if it goes down past a certain point, there are going to be tens of thousands of people in New Hampshire who are without coverage, which is just kind of picture setting for what is happening in the state budget. Mm. So, the budget as it stands right now has a few different provisions about Medicaid. One of them is a 5% premium on Medicaid expansion recipients. So for people who are getting their healthcare through Granted Advantage, they would have to pay a 5% income tax to keep their coverage. These are people who are already making very, very little money or already really struggling to make ends meet. And so taxing them is ridiculous.
Why tax the rich when you could tax the people who need services the most?
Right. So, and we'll come back to that in a second. The other piece is increasing the copay for prescription medications. So right now, people who are on Granted Advantage pay usually a $1 or $2 copay for which is, you know, the money that they pay that insurance doesn't cover for their prescription medications. They are wanting to raise that copay up to $4, which doesn't seem like a huge deal. But again, if you're already struggling to make ends meet, every dollar counts. Right. And we've heard from providers, especially providers who run free clinics, like the difference between something being free or very low cost and being slightly more is the difference between somebody taking their medication, their life-sustaining or life-saving medication, and not taking it. There's already been a lot of data to suggest that over a quarter of people with chronic illnesses, this was a study from the Commonwealth Fund a couple of years ago, in the year period that they did that survey, over a quarter of the people surveyed with chronic health conditions reported not getting a prescription that they needed to manage their condition because of cost. So these are things like COPD, heart disease, asthma, diabetes, right? Things that need constant maintenance and care, or else you can get really, really sick and die. And so that's where the copays are such a big deal, because it makes a difference between people being able to keep up with their like kind of maintenance healthcare and not. What you said about taxing the rich. So about a month ago, myself and a few other advocates met with Governor Ayotte after being ignored by her and her staff for several months, and then sitting in her office until somebody would set a date and time for a meeting with us.
Good for you.
Iconic.
Yes.
Slay. It shouldn't be necessary,
Nope.
but we did it. In that meeting, I asked her director of, I think his title is like director of financial policy or something. But I basically asked her staff, how much is the line item in the budget? How much would it cost to not tax people, to not do a 5% tax on Medicaid premiums, and, you know, all other things being equal, like, how do we make it, what does it cost to not cut Medicaid in this way? And he said, you know, I'd have to check, but I think it's about $3.5 million. Let's contrast that with one of the first things the governor did when she got into office, which was get rid of something called the interest and dividends tax, which taxes people's stock portfolios and basically only impacts like the top, it mostly impacts the top 1% of earners in the state. It somewhat affects the top 20% of earners, but really it's like that upper echelon of people, right? That tax alone, even at a reduced rate in 2024, brought in $184 million in state revenue in 2024 alone. And they're saying that we need to tax people at 5% of their income for health insurance over $3.5 million.
So that $181 million, you know, that other that she was getting from those is still not even
right. We can't use that. We can't consider that part of the pot, like to pull from for the budget. Sure. And so when we had this meeting with her, we were telling her, you know, like, hey, this is a bad idea. don't do this tax. And she was like, well, New Hampshire has some of the highest Medicaid eligibility in the country. So what that means is, like, I believe the average eligibility for Medicaid expansion, because there's like a couple different categories that people can fall into, but like the average number is like 225% of the federal poverty line is the maximum amount that you can make to qualify. In other states, it might be 180% of the federal poverty line, right? So we have broader eligibility. And so the way that she's framing it is, in order for us to keep that eligibility, we have to tax these people. And what we're saying is, you can keep the eligibility and not tax these people if you take a little bit of money from the top 1%, Kelly. So yeah.
That feels like it's a theme, you know, as we're getting more and more engaged with local politics in New Hampshire specifically, it seems like that is a common thread that we're seeing, that we are very focused on New Hampshire in cutting taxes, but really that means cutting taxes for the people at the top. Yes. And then who is suffering? It's people on Medicaid, it's schools, it's these programs that the bulk of, like, the big portions of the community need to survive, and instead we're just throwing them to the wolves. So I just want to recap a little bit, because that was really helpful, but it was still a lot.
Yes.
So for people who are trying to wrap their heads around it, can you give us a couple sentences about sort of what is happening on a federal level and how that's sort of ultimately going to roll down to New Hampshire? And now in New Hampshire, we're putting ourselves in a worse position to manage what's coming at a federal level. Is that right?
Totally.
Yeah.
So federal level, federal budget, the current proposal on the table cuts something like $800 billion from Medicaid nationally. That means that federal money that New Hampshire would get from federal Medicaid, we're not getting as much of. So now we have less money to pay for our Medicaid programs. And the first thing that's going to go when that happens probably is home and community-based services, because we're not legally required to provide those in the same way that we are institutional services. And so the cuts are going to manifest in the form of programs going away, services going away. And at the same time, in our state budget, we are seeing a proposed 5% tax on Granted Advantage recipients and increased copays for prescription medications. So the hits start coming and they don't stop coming.
Wow.
And it's going to have disastrous impacts, not only for people who receive care through Medicaid, but for family members who are going to have to leave the workforce in order to care for them if they don't have caregivers, professional paid caregivers available. there was a provider rate cut proposed in the state budget that is not there anymore, which would have meant that how much the state pays providers to provide healthcare services to people on Medicaid, that number would have gone down, which would be bad, because we already have a provider shortage. But that's not happening in our state budget anymore, which is good. But because of the cuts that are happening at the federal level, we will still see providers who are no longer able to keep their practices open because they're not getting the reimbursement that they need from Medicaid. Then that not only impacts people who are Medicaid recipients who are patients of theirs, but it impacts everybody else too, right? Because you have fewer providers operating in the state. So it really has this ripple effect that's terrible for everybody. And the narrative in the media and out in the world continues to be one that Republicans aren't trying to cut Medicaid, which is false, but they keep saying it because they know that cutting Medicaid is not popular. And two, that, well, the people who use Medicaid need to just get a job and provide for themselves, when we know that most of them are already working, and the ones who can't really can't and need supports and services to be able to stay alive.
Also, like, nobody can get a job right now too. Like,
Yeah.
and even if that was true, it's not like
just get a job is not very helpful advice right now, actually. Yeah.
There's a lot of things wrong with that.
Oh my gosh. Yeah. So you just told us a little bit about like the populations that are going to get hit, especially like the providers as well. Are you hearing stories from these folks who are going to lose their care, or the providers who are going to lose their business? Are you hearing stories from those folks?
Yeah, I mean, a lot of people are really scared. I've heard from a lot of parents whose kids who have kids with like complex medical needs, who just have no idea how they're gonna get the services that they need to like keep their kids alive, much less like succeed and thrive. A lot of providers, share those concerns about like not being able to provide services. There's, like I said earlier, we already have a home health care staffing shortage in New Hampshire. And so this will kind of create, longer periods that people are going without care and fewer spots on the waiver lists, which means people have to either wait a very long time for services or go without services. And that makes the difference between life and death for people. And I think that's something that I don't think a lot of people understand, is that the services that Medicaid provides are not just nice to haves. They are what keeps people alive. A couple of jobs ago, I was a direct service provider. I installed like accessible communications technology for deaf and hard of hearing people, deafblind people, people with other communication disabilities. A lot of them had like co-occurring disabilities as well. And there was a guy whose home I visited a couple of times, who was deaf. I was installing like some phone technology for him and trying to get him set up with like an accessible mobile phone and stuff. And I got a call one of the days that I was supposed to go over there, and found out that he had died because he had a heart condition, and his appointments kept getting pushed off because he couldn't get a ride, or they couldn't get an interpreter scheduled for the appointment, or whatever excuse. You can only put off care for so long before it catches up with you and you die. And unfortunately, that's not a unique story. There are many people who are killed by our healthcare system because their care is denied or delayed long enough that they can no longer survive.
Yeah. I think like more and more people are, I don't know. It's like so much. And I want us to like sit in that, the discomfort of that for a minute, where it's like, we're talking about this sort of dry policy stuff.
Yeah.
But this has a very real impact on people's lives. And I think we all understand that the medical system in the US is like broken in a lot of ways. And we've all had our own, in our families, whatever, have bumped up against it in whatever ways that we have.
Right.
And then, but really like hearing that story and thinking about how many others I'm sure you've heard like it, the impact when we start stacking up all of these cuts on top of each other is just so scary.
Right. And, you know, like we're talking just about Medicaid, but like you think about, you know, there are all these cuts to like SNAP and other food assistance programs that are looming because of federal and state choices as well. And all of that stuff compounds and creates situations where people's health is, you know, at risk. You know, getting rid of like infectious disease protocol and precautions, saying that vaccines cause autism. Like all of these things have a stacking effect. And I think what I've noticed in throughout my career doing this work is that you said, right? Like we all know, we've all had these situations where something's gotten denied by insurance, or we haven't been able to schedule an appointment for a year, or, you know, something has been denied or messed up. But the people who are making decisions have never faced those circumstances because they can buy their way out of whatever problem they're having. And they forget or are willfully ignorant of the fact that that is not the case for the majority of Americans. And certainly not the case for the majority of people living in New Hampshire. You know, the people that are going to be harmed by this are working class people, parents, families, children, who, you know, are just trying to make ends meet and survive. And we are making policy choices that endanger their ability to do that.
And sorry, go ahead.
I was going to say, when you are talking to the people that are making these decisions, or anybody opposing what you're saying, or, you know, being for these budget cuts, and you're giving them these statistics and these stories, how are they taking that and continuing to stand on that leg?
Yeah, I mean, it's they present it as something that is necessary for a quote unquote balanced budget. That's why when we brought up these 5% cuts, that's why the governor's first thing was to say like, oh, well, we're only doing that so we can maintain our great eligibility window. And it's like, well, you're creating a false dichotomy. We don't have to narrow the eligibility window or tax people for their health care. We can just put the money into the budget that we have cut from taxing billionaires to pay for that. It's really not hard. Yeah. But the way that they justify it is by perpetuating this messaging that is, you know, saying that people who are on Medicaid are bad, lazy people, and creating these lies, right? Like they're creating this scarcity narrative, like, oh, well, we have to make tough choices to balance our budget. Bullshit. No, we don't. There is plenty of fucking money that you could be getting from people who have plenty of fucking money, and you're choosing to keep it in their pockets instead of using it to pay for programs that keep people alive.
And that's why Kelly Ayotte avoided you, because she didn't want to have to face the harsh truth of that.
Yeah.
I can see why politicians are hiding right now.
Yeah.
Politicians are hiding, and they don't want to have to deal with us face to face because they don't want to see the reality of this. And it's very disappointing, and I think it's going to have, it's awful. But I want to know a little bit more about what happens now. So you, like you said, you guys camped out in Kelly Ayotte's office, which I think is amazing because these people need to be held accountable. At the very least, if you're going to do something that could potentially like literally take lives, you need to at least have a fucking adult conversation with me about it.
Yeah.
So what else? What else are you guys doing? How can our listeners support you? What comes now?
Yeah. So, the 5% Medicaid premium and the increase in copays are the two things that we are still kind of attacking in the budget process. Right now, the Senate Finance Committee is marking up their version of the budget. The House has already passed their version of the budget. What happens after that is the House and the Senate come together and they reconcile their two versions of the budget to make one that they will both agree on. And then the governor either signs it and it becomes law, or she vetoes it, and the process kind of loops back. So the Senate will be voting on their version of the budget on June 5th. That process where the House and the Senate get together to reconcile, that's called Committee of Conference. That's going to happen like mid-June. And that's really the part that we're going to be doing probably more direct action and more intense like communications campaigns around, because the Senate has kind of done what they're going to do with their part of the budget at this point. The House is full of people who need to hear from their constituents.
They don't like to hear from their constituents either, do they?
Yeah, so that's really where the pressure is going to come on. We're planning for that, and then in tandem with that and afterwards putting pressure on the governor to veto a budget that contains these cuts. So what that looks like is the New Hampshire Hands Off Medicaid Coalition is a group that I've been working with. We're the ones that like organize that sit-in in the governor's office. I guess we can like share a link or something.
Yeah, we'll have lots of links for everybody in the show notes. We
have a sign up form where you can like get our emails, come to our meetings, and then you'll just be kept in the loop of like stuff that we have going on. And I would say that's like probably the best way to keep up with us. Also follow us on socials. We just posted a plain language explainer that like really breaks down in detail in like very simple language, like everything that we just talked about and like what you can do and how to contact people. So definitely like read that, check that out. And then I would say some other great groups to like keep an eye on that put out great information about what's happening with Medicaid. New Futures on social media posts like a lot of good helpful updates and explainers about what's going on. Kent Street Coalition does a lot of good like direct action and like visibility work, like holding signs and doing rallies and stuff if that's your jam. I think those are the things.
So this whole podcast is geared towards folks who are super busy but really want to get involved. What is one quick thing that you would recommend to get involved with this advocacy?
Sign up for our email list. You just put in your name and your email, and then you'll know what's going on.
Love it. So many people, knowledge is power, I feel like, with this stuff, and I think so many people are trying to get engaged, and like that explainer was so helpful. That was helpful for us in getting ready for this.
I just learned what Medicaid is, you guys.
Getting really into the nitty gritty of it, I think, has been really helpful. So Thank you for everything that you're doing to educate, and hopefully the community is going to continue to show up for you and the work you're doing.
Thank you. Yeah, thank you for having me. It's so great. Love what y'all are doing.
We'll come with you next time you need us to sit anywhere.
Oh, good.
Oh my gosh.